Good afternoon, everyone. We are Group 8, and our topic is AI for COVID-19 government policies. The spread of COVID-19 has changed everyone's life, and there have been more than 5 million confirmed cases worldwide. In response, governments around the world have made lots of policies to control the pandemic, but some of the policies are controversial and their effectiveness is unknown. First, we are trying to identify the effectiveness of the chosen policy sets and the impact of individual policies through AI. The big idea is to first train tree-based regression models with government policies as features to predict RT. Since effective reproduction numbers represent potential for epidemic spread, it can somewhat show the effectiveness of a chosen policy set. Then, we evaluate the individual policy by feature importance and correlation with RT. What's more, we interpret the results among different countries. Our dataset is from the Oxford COVID-19 Government Response Tracker. It includes 24 government responses in 4 classifications: containment and closure policies, economic policies, health system policies, and vaccine policies. Higher degree value means a policy is stricter, and the binary flag is set to 1 when the policy is implemented across the whole country. Some of the data has missing values, so we do the pre-processing first. We handle special features, such as making the age range of vaccination become numerical values, and we fill those missing values according to the policy type. To train the model with different countries' data, we introduced population and population density from other sources. Finally, we applied transformation and normalization. We use this Python package to calculate RT based on reported case numbers, GT distribution, and delay distribution. Besides, we estimate that the policy takes effect after 14 days, so we do the label shift of RT. Here we adopted 2 ways of training models. The first model is trained on the policy data of all countries, and we also tried training a model for each individual country. The results show that time series prediction into the future failed. However, we can still fit current observations and evaluate the effectiveness of policies. The R-squared scores of both the cross-country model and the individual country model are acceptable. For model interpretation, we use Shapley additive explanation, also known as SHAP. SHAP values represent how much this feature contributes to the output of this row's prediction. We visualize the impact of features with dot plots. In the plot, the x-axis is SHAP values, and the y-axis is the features. The red dot means a higher value of a feature, and the blue dot means a lower value of a feature. By reading it, we can know the contribution of each policy. For example, we can notice that the enforcement of facial coverings, vaccines prioritization, school closing, and testing policy are quite effective for lowering RT. On the other hand, the international travel controls are not so effective in the results. We also plotted the SHAP values for each individual country, but due to the time limit, let us focus on Taiwan's results. For Taiwan's results, we can identify some effective policies for lowering RT, like restriction on gatherings, workplace closing, restriction on internal movement, and cancel public events. These policies are mostly related to social distance. On the other hand, income support is not effective for controlling the COVID-19 spread, which looks quite reasonable. For each policy, we count how many countries benefit from adoption. The highly adopted policies among countries include public information campaigns, school closing, testing policy, and restriction on gatherings. In conclusion, we evaluated the effectiveness of different policies based on the reduction of RT for both cross-country models and models of individual countries. The results can be a preliminary reference for governments to decide on which policy to use, but it only shows correlation instead of causal relations and may need to be interpreted carefully. Thank you for listening.